Okay, so we have here the pre-transfusion testing. So this topic will discuss all about the compatibility testing that we need to perform prior to the actual transfusion of the unit of the blood of the patient. So when a patient requires a unit of the blood for the transfusion, so number one, you should have here a request coming from the physician that the patient should be or the patient requires a unit of the blood for transfusion that would request for the compatibility testing. Second, when you have already the request, then you need to collect the sample here correctly from the patient. Should be given a unit of the blood. So clerical error is the main error, the main problem or the error here that's being caused in the blood banking procedure or the blood banking area of the laboratory. Clerical error is something to do with not able to correctly identify the patient that's supposed to be collected with the blood. So the patient has been collected with another patient. We're supposed to be not. So you need to properly collect the patient's blood and should be the one going to be used for the compatibility testing. Just remember that transfusion medicine or blood transfusion to patient is a very risky na procedure, and therefore you should do all the procedure correctly. Okay, number three here, so you need to test for the recipient's specimen. So what are you going to do to the specimens of the patient here or the recipient? So you need to perform ABO typing, RH typing, and also antibody panel identification. For the unit of the blood that should be transfused to the patient, what are the tests you're going to perform? Perform also the ABO, also perform the RH typing, also perform here the antibody screening, and of course here test for the presence of your serological test here for the transmissible diseases. That includes you should test here for the test for the malaria, test for the syphilis, test for the hepatitis B, hepatitis C, and test for the HIV, which are transmissible na transfusion transmitted na mga infection. Number 5, then you perform the compatibility testing. And number 6, once the result of the unit of the blood and the recipient blood is compatible with one another, then you need to label properly that this blood has been used for the cost matching for this patient. So baka iba ang ginamit mo for the transfusion, for the cost matching procedure, tapos compatible siya doon, pero nung nirelease mo ng blood, in the blood bank natin, iba yung blood na binigay mo sa nurse for the transfusion, so magkakaroon pa din ng incompatibility with that. Okay, we have here the procedure for compatibility testing. Compatibility testing, we have two types of that. We have the major and the minor cross-matching procedure. The major cross-matching procedure is being done by the PSDR, so patient serum, into the recipient serum, tapos ang imimix mo doon is the donor's red cell, PSDR. Mean to say, blood bag na isasali natin is gagawa ka ng red cell suspension, tapos ito sa recipient, kukuha ka ng serum na niya, and your success or the compatibility here with the compatibility testing here, if that one is compatible or not, will be highly dependent on na dapat si recipient, since nasa kanya ang serum, wala siyang antibody directed towards the red cell antigen ni donor natin. Pag minor naman, so that's your PRDS, patient red cell, saka donor serum. So, donor serum. Patient red cell and donor serum. So, nagre-rely dito kung compatible siya o hindi. Kung anong meron sa serum ng patient natin, ng donors natin na serum ng antibody with your patient's na red cell. So, always i-check mo kung kanino ang antibody. Kung kanino ang serum na sample, so, titignan mo dapat wala siyang antibody directed towards your red cell antigen could either be a donor or recipient. Kung major, so dapat ang recipient, check mo kanyang antibody. Dapat ito ay walang antibody directed towards the red cell antigen ni donor's blood natin. Pag minor naman, check mo ang antibody ni donors natin. So dapat siya ay walang antibody directed towards your recipient na red cell for you to determine the success or the compatibility or compatible or not with the test result. Okay, then you perform here two phases, just like when you're performing your indirect antiglobulin tests. So like this one. Okay, so you carry that one in two phases. You can have your immediate spin. Immediate spin will try to detect for the ABO incompatibility. because this one is an IgM antibody. But for those other blood groups, which are IgG antibody, you can detect that one by doing here the antiglobulin phase, incubation at 37 plus carrying that one, proceeding that one with your antiglobulin testing. Requirement. Okay, ano ang ilang ang days or duration ng serum dapat ni patient natin para magamit for compatibility testing? Dapat less than 72 hours. So, hindi pwede na ilang days na naka-ref ang specimen natin, more than 3 days. So, it's not already ideal for compatibility testing because the antibody of that might deteriorate already in the storage. And that might be able na baka compatible siya or negative siya. It's because bumaba ang level ng antibody niya but actually meron siya. Kasi hindi fresh ang specimen natin. So, for that, ang serum natin should be less than 72 hours. And after that one, mag-perform tayo ng compatibility testing. You try to store your blood na ginamit for compatibility testing for both the donor and recipient. After 5 days mo pa pwede siyang itapon. Bakit after 5 days? It might be because after the blood transfusion, baka magkaroon ng untoward agglutination reaction o transfusion reaction. So, pag nag-investigate sila, so, kailangan mo may sample ka pa din sa ref. Hindi mo pa muna siya tinapon in order for you to check kung tama o hindi talagang ginawa ni Metek with that. So, after 5 days mo pa siya itatapon. Okay, then we have here the causes of your positive cross-matching, meaning to say pag positive, that would signify na incompatible ang ating result, meaning to say may agglutination reaction. First one, hindi compatible ang ABO blood group ni recipient sa ni donor natin. So remember that in this major, so we are considering na ang antibody ni recipient versus your red cell antigen ni donor. Sa minor naman, ang antibody ni recipient versus the red cell antigen ni ni recipient. Another one, the presence of your alloantibodies, the presence of your autoantibodies. Number 4, prior coating of the donor RBC with your plasma proteins that would have your false interference with your antiglobulin testing. And number 5, we have here abnormalities in the serum or even contamination in your test system, like for example, may bacteria, may mga small agglutinates na napagkamalan mo na may agglutination reaction, actually wala. And that might result here to false interference. Okay, then we have also here the suggested blood type here that should be given to the patients. But our rule for the blood typing here is that it should be group specific. Like if whatever the blood type requirement of the patient or whatever the blood group the patient, that's what should be given to the patient. Like if your patient is type O, dapat type O ang bibigay natin. Or if the patient type B, then type B ang bibigay natin. It should be group specific. But sometimes, depending on the availability of the unit of the blood in a blood bank, you can have here other options. Like for example, for type AB, you can give AB, then you can give A, B, and eventually O. For type A individual, you can give A or O, since naman ang O natin walang antigen. Ang B natin, so if your recipient type B, then should be given a blood coming from your type B or even type O na patient. Pag type O, so type O lang, you cannot give other blood groups. Because again, this one contains all the antibodies sa recipient natin. We have also here the selection of the appropriate blood units. So again, ang rule natin, blood specific dapat, type specific. But in the case of your emergency, okay, so you can give O or O red cells here because again, this one do not have the antigen. So kahit ano pang merong antibody sa recipient natin, it will not give an untoward reaction. It should be Rh negative. So, kahit negative or positive ang ating recipient, so wala pa rin magiging effect ito. Another one should be red cell, PRBC, rather than the whole blood. Because, of course, red cell here would have less the volume compared to the whole blood. Another one for the Rh. So, if the recipient is Rh positive, then you can receive blood coming from Rh positive or even Rh negative na patient. So, Rh negative could be given to your Rh negative na recipient or even Rh positive. Rh positive, pwede mo din siya ibigay sa ating Rh negative na patient. Kaso nga lang, pag wala ka talagang option. Okay, so, Para usually kasi pag negative ang ating patient, dapat binibigyan mo siya ng RH negative then para hindi siya ma-expose. And therefore preventing the development of your anti-RHD antibody. But in the extreme condition, so pwede kang magbigay ng RH positive na blood to your recipient even if the recipient is RH negative, provided that number one, your recipient is lalaki, hindi naman siya magkaanak, di ba? Or postmenopausal na patient na babae. So hindi na siya magkakaanak. And therefore, you were able to prevent your hemolytic disease of the newborn because of that. Pero again, ang rule natin, pag ikaw ay recipient na RH negative ka, dapat binibigyan ka ng RH negative na blood. Okay, kung ikaw ay RH positive, so pwede kang maka-receive ng blood na RH positive or even RH negative. Walang magiging side effect. Okay, then we have here your antibody panel identification. So if the recipient, for example, is positive for the antibody, so ano ang bibigay natin na blood? So dapat maghanap ka ng recipient na blood na the antigen for that particular antibody is negative. Like kung meron siyang anti-FYA na antibody ang recipient, so ang donor's blood natin dapat is FYA negative. Hindi ka pwede mabigay na ang patient na recipient natin may anti-FYA, tapos bibigyan mo siya ng FYA antigen positive. Magkakaroon ng antigen antibody complex, the result here to hemolytic transfusion reaction. Pero may rule dito na kahit daw na positive sa antibody ng ating recipient, pwede mo siyang bigyan ng antigen positive directed sa kanyang antibody na positive siya, provided that the antibody is not IgG antibody. Okay, then we have also here for compatibility testing using your plasma products. Your plasma products includes your fresh frozen plasma or even your platelet concentrate, wherein ang ating blood component na yan ay wala siyang red cell. So pag ganon, you can actually perform or not perform your compatibility testing. Usually, kahit hindi ka mag-perform ng compatibility testing, walang mangyari. Remember that your donor's blood, which is the plasma component, wala naman siyang red cell antigen, wala siyang RBC. And therefore, kahit isali mo sa patient, recipient na walang compatibility testing, walang mangyayaring reaction. Provided na ang donor's blood natin na plasma, walang nakakontaminate na RBC. Kung minsan man nakita ka na red cell, okay, pag more than 2 ml ang red cells natin, so medyo delikado na siya, you need to perform yung compatibility testing. Baka sa red cell na yan ay may corresponding na antigen sa recipient natin na recipient na antibody. Or another one, you should also perform the compatibility testing with the plasma transfusion if your plasma being given to the patient is sobrang dami niya. But by nature, pag plasma ang sinasalin sa patient natin in the form of your fresh frozen plasma or even the form of your platelet concentrate, safe siya for the blood transfusion. Again, kasi wala siyang red cell naman ang ating donor's blood. Okay, in the case of your neonatal exchange transfusion, so you need to identify the blood type. Okay, in order for you to have the identification of the blood type here, so try to check for the blood type of the neonates by checking here the red cell of them. Okay, perform here the forward typing. You can also use the serum sample of the mother cord serum here by doing your reverse typing. So that would help you then to really identify the specific blood, ABO blood group ni baby natin. For the intrauterine transfusion, so pag alam mo ang blood type sa RH blood type ni baby natin, then you give type specific. And to say kung type A, RH positive ang baby, then RA, give also A and RH positive na blood. Pag hindi, pinaka-safe is you give the type O, you give the RH negative, and then red cell instead of the whole blood. Again, that one would be the safest for you to perform your intrauterine exchange transfusion. Your intrauterine transfusion, I mean. Okay, so that's all about our pre-transfusion testing. Okay, thank you.